Hello, my name is Joseph Schrader. I am a fourth year dual majoring in health sciences and education sciences with a specialization in disabilities and society. And this is my final reflection presentation for EDG 4078. Alrighty, let's begin. So quickly before we begin, I'll go over a quick overview of what will be going on in this presentation. So here's a quick table of contents. Firstly, we'll look at the project overview, and then we'll be looking at some of the roles and the assignments that I had within those roles. So my first role was a rehab tech. My second role was a lab volunteer. My third role was a teaching assistant. And afterwards, we'll be looking at some of the overall learnings I had during this experiential learning project, how this helps me in the future in my career, and some of the connection to the coursework. Alrighty, let's look at an overview of the project real quick. Now, one question some people might have when looking at my project is like, why would you do three roles instead of one? And I know this sounds interesting, but because I'm dual majoring and because I have a career in healthcare, I wanted to try to have a diverse area to look at in order to have an understanding of how education is important to me in my career. And so through these three different roles, I wanted to see, okay, how can I connect education to them and how can they help me grow in my understanding of education in my career and in my educational career as well. Oh, you know, Uh, before we delve deep into my first role, I think it's better to change myself into more proper attire. So let me change real quick. Oof, I think we're in better attire now. So now we can talk about my first role as a rehab tech. Alrighty, now that I've changed into some more proper attire, we can now talk about my first role. So where was my first role? My first role was at HCA North Florida Hospital, which is on Newberry Road here in Gainesville, Florida. It is a 523-bed hospital that offers a wide variety of medical and surgical acute care. This hospital is really special to me. I think it's very amazing. It provides not only orthopedic care, women's care, care for pregnancy as well. It also provides care for strokes, patients who have cancer, who have need bone marrow treatment, and patients who just need a variety of surgical and medical treatment within the hospital. I think it does a very good job of helping and treating patients who come in and out. And of course, within this hospital, I worked within the rehab department, and the total amount of hours I had here was 170, which made the bulk of my hours, of course. All right. So, what did I do here as a rehab technician? So, I would say my role was split into two types of domains, clerical and patient care support. So I'll talk about the clerical part real quick. So in this picture right here, we have an example of like what my workstation looks like. I can't really take that many pictures on site within my role, and I can't really take that many pictures of the computer as well, just because of HIPAA and making sure that we have privacy for patients and patient rights. But this was a picture of therapy board, an application that we use to help organize some of our patients within the apartment. So some of the clerical work I do involves updating PT, OT, and SLP caseloads. So every single day we get new consults, and we also have a running large caseload of clients and patients that we need to see every single day. And every single day when we have a set of therapists come in, we organize their schedules and we make sure, okay, are they seeing enough patients? Making sure they don't see too many patients, and also making sure that the patients they see are appropriate and fit their skill sets as well. And with this, we also assign priority patients who need to be seen. So this involves making sure we see stroke patients and also updating tags in case patients have special sorts of abilities or equipment needs that need to be addressed during treatments and sessions as well. So this includes like if they need a lumbar support, if they had a surgery recently, and all sorts of other equipment that could be used during those treatment sessions. And part of our role as well doesn't just involve the computer as well. We also keep track of all of our department's equipment. One thing that we also do is keeping track of wound care. So we work hand in hand with wound care to keep care of very expensive wound care devices. So they're wound vacs. So basically, if a patient has an open wound that does not heal properly and needs to be suctioned to make sure that healing process goes well. They attach a wound care device to them, and when they're finished, they're clean, and we keep them in our department. We keep track of them every single day just to make sure that they're not lost, and we make sure that we don't um, cause any damages to them as well. So that's an important part of our job, making sure that equipment is in the right place and returned as soon as possible to make sure patients have the appropriate care needed. And with that clerical work done, one of the most important parts of my job that I also find very rewarding is being able to work with clients and patients with patient care support. So this can include delivering therapy-related equipment to patients and therapists when treatment sessions are going on, but most importantly, when we are called to help a therapist in a room or in a specific department, we will come and we can help with transfers, lifts, and any sort of treatment or evaluation related needs that might be going on. So some patients might be a little ill or might be a little weak and might need more than one person or two people to assist, and that's where we come in. And I think it's very helpful because um, we can provide personal encouragement to them, and we can also help understand uh, how we can help them during their time in the hospital as well. So it's very rewarding. So here's a picture of me in my scrubs. I wasn't, of course, able to take pictures with patients or any other staff members just because I want to make sure that everyone is able to keep their privacy. But what did I learn from this opportunity? Of course, being in a healthcare career path, I had some very valuable patient care experience. But to connect this to my educational career as well, I was able to learn how to properly talk to family members, educate them on specific ways to help their family members mobilize themselves, which is really important because, the importance of understanding how to provide detailed, but also like uh, accessible information to family members is super important. So that was a very good thing to learn as well. I also during this time encountered some patients with both physical and developmental disabilities, which helped with me gain some insight on how to talk to them about their disability and also engage with them. So this included some patients who had, of course, like mobility devices or some sort of developmental disability, including autism or uh, Down syndrome that could you know make the treatment session a bit different. And it's important to understand how to be competent during those times when communicating with them. And during this time, I also learned the importance of continuing education in healthcare, which is one way I found to connect my healthcare experiences to education as well, because um, despite being in the healthcare realm, you're always learning. And so I think that's a good way to connect education into healthcare. Oh, and now that I finished my last point as rehab tech, I actually have to go. I have a shift soon, so I'll get going now. Oof. Sorry, rehab technique. I had to leave for a shift, so presentation me when I'll be back to talk about part two and part three of my roles. Alrighty, now that we've changed back into the presentation attire again, I can now talk about my second role, which was a lab volunteer. So where did I work in the lab? So I was able to work under Dr. Jessica Kramer, who is an occupational therapist, in her Youth and Young Adult Empowerment, Leadership, and Learning Lab, which is also called, for short, the Yale Lab. This is a course in the Community Core building at the University of Florida, and the purpose of this lab is to empower and involve young adults with developmental disabilities. So a lot of the purpose of this lab is to conduct research and involve young adults with disabilities in finding opportunities and resources to engage themselves in the community and also find work opportunities as well. I think it's a very good resource and place to understand and learn how we can better develop resources and interventions to help young adults with disabilities transition into adulthood. So, what did I do during my time in the lab this semester? So, my main focus this semester in the lab was working on the COSA T. So, the COSA T is called the Child Occupational Self-Assessment for TICs, and this is a version of the original COSA. The original COSA is an established assessment for occupational therapists to use in the pediatric setting, and this specific type of COSA T for tics is used for children with Tourette syndrome. And so The study that we were looking at interviewed a lot of occupational therapists within group settings to see if they were able to get any effectiveness out of the development of the COSA T, and as well as their thoughts on the potential implementations of the COSA T in outpatient settings. So it was very interesting to work with them, and of course, like it was very cool to see like some of their perspectives on the COSA T as well. And so um, here is an example of some of the work I would do inside the lab. Right here is an example of a workstation I would work at. And in these two pictures, as I'll explain, is kind of part of start of the process that I was doing when working in the Yale lab. So a big part of this activity was working with in vivo and transcribing text into the software and making sure that we were adding and annotating all sorts of text within the documents as well, and adding codes to any sort of important information that was assigned to text. So, for example, um, uh, Dr. Jessica Kramer and her assistant, Thyla Shug, had already prepared transcripts of the interviews that they performed. And so our role was to highlight them and make sure they were added to codes. And these codes were basically ways to organize and theme all of the information that was used within the interview. And so this helps them look at some of the trends and organize the information to perform and present um, a research article later on. And so it was really cool being able to come in every single week and help transcribe all of these documents. And it, of course, was a lot of tedious work, but I think it was very valuable to learn some of the behind the scenes and making and also contributing to a research project. And I think that was very cool. And so, of course, this helped me understand the research process and also taught me some analytical skills and patience as well. All right. Now that we've talked about our second role, we can now move on to my third role. So my third role this semester was as a teaching assistant for Professor Maxugagage in her class EEX 2000, which is also called The Impact of Disabilities, Home, Work, and Community. All right, and this is a screenshot of what the homepage of the Canvas course looks like as well. All right, so what did I do as a teaching assistant? So um, the main part of my role as a teaching assistant this semester was to grade and review assignments. So this is, of course, an online course. So most of the work that we are doing is um, online, involving providing online feedback to students. So the two types of assignments we were grading this semester were called media review assignments and packbacks. So media review assignments ask students to review different forms of literature every single week and then provide analysis on them. So we would provide feedback and grades for these assignments. And packbacks were a form of discussion posts. So we'd also provide feedback on these assignments as well. And on the right right here in this picture is an example of the organized grading system that I used with my TA partner. Of course, I deleted the student names and hid them just to make sure, there's some sort of anonymity because, we want to make sure we keep everything private. But this is an example of how we would keep track of our assignments grading and make sure that we're getting everything done every single week. But yeah, it was very cool being able to access Canvas as a course instructor or on the other end because you get to see how the courses work, and I think it was very cool being able to provide feedback and learn how to look for what you want to look for within assignments as well. So I think that was very cool. All right, so um, here are some of the key takeaways that I had when working in my third role as a teaching assistant for Professor Maxwell Gage. Of course, this was providing feedback, reviewing work in the teaching process. So this helped me develop some understanding of how I would like to provide feedback to students just because I was doing it on a consistent basis. And then when reviewing work, I also learned how to look for specific details that I would want to look for. And I think like working with a rubric also helped that as well because I think like as limited as rubrics are sometimes they also give you a framework as to understand where to look for specific details within assignments and also help me understand the teaching process because as earlier we met every single month with the course instructors to make sure that we were making good progress. So it shows how organized everything is behind the scenes. Okay, so now that we've looked at all three roles, we can now talk about my overall learning during this semester. So Of course, I think with these three roles in mind, I think my biggest challenge was finding balance. I think it was very difficult finding time to fit all three of my learning opportunities in. I think it was really difficult to balance that with coursework as well. So I think a big thing was just making sure that like I was on point with every single thing I was doing and making sure I was on top of things, making sure that they were done early and done in a timely fashion. And of course, there was a bit of burnout associated with this. So finding a balance between both leisure and also like, learning was a big process that was hard to uh, balance it at first. But it was very rewarding. So I think one area of continued development I'd like to work on during this next few years would be learning on providing effective feedback. I think this semester in all three roles, I definitely was given the opportunity to provide feedback to not only students, but also other peer members. I think while I think I did learn and grow a bit on my feedback skills this semester, I want to continue to develop this because, being involved in education and healthcare, you are constantly asked to provide feedback to other people. So I think this is a very important area to grow. So, to reflect on some of these experiences on my career, I think what I realized is that, like um, education will always be a part of my career. I love teaching and learning, and also it's just helped bridge a gap between my interest in education and healthcare. I think that's super cool. I think it provides a really cool connection between two of my majors and helps me understand how education fits into my goals as well. So, how will this help me in the future? Of course, being in the healthcare field and potentially having a career in healthcare, this provided me with some very valuable patient care experience, which came from my first role. Um, and then I just wanted to emphasize as well that like each three role provided a unique experience that added into my understanding for the major. So like my patient care experience also provided an understanding of how healthcare fits into education. So, like, how can I frame my healthcare career in an educational framework? Um, I gained some research experience. So this helps me understand not only like an understanding of disabilities, but also like how I can uh, create and develop literature that other people can use. So like, being involved as a scholar and also just learning how to involve myself in teaching experiences through my TA work. Okay, so how does this connect to my coursework? So as I mentioned earlier, my education sciences degree is focused on disabilities in society. And I carefully organized this project to make sure that all of the roles that I took place in involved some sort of engagement with disability. So, for example, my patient care experience with my rehab tech role was deeply involved with patients who had acquired physical or developmental disabilities at work. My research role in my lab volunteer role with the Yale lab was focusing on research on young adults with developmental disabilities. And the last role that I had with the teaching assistant with Professor Maxuga Gage is also involved in a course that involves teaching about disabilities to other students. So all of these roles were thoroughly involved in disabilities and how disabilities can connect to the educational experience. And of course, like these are some of the key concepts from my coursework throughout the years that I applied within my interactions with people during this time and my roles. So yeah, I thank you so much for listening to my presentation, and thank you so much for this opportunity to grow as not only a student but also as a professional. Thank you very much.